Good morning. The Major Dome over the station, Mr. Jim Ash, gave us a nod of approval and said the Viewpoint is officially on the air this morning. Viewpoint, the program of personalities, politicians, and perspectives. We're going to get 2 out of the 3 today.
Yes.
Welcome back, Mrs. Busby.
Thanks. I had a good
kind of
time.
bereft last week without you.
Oh, were you really?
Oh, yeah.
Well, let's see now. That's the first time I can ever remember anybody saying that they missed me.
Well, work on that for a while. You certainly came up with something a little closer than that. Yes.
Well, it's good to be back because this is a nice place. I mean, it may not be beautiful, but it's nice people.
Well, what the lady says is true, Mr. Ash. It's not very pretty.
What are you going to say, Jim?
Functional would be the
Truth
word.
is truth,
Well,
you know.
Functional. We're functional up
Yeah,
here.
well,
That's
yes,
all.
we're very
It works out
functional.
very
We are
well.
that. Yes, we are.
Speaking of functional, something very basic about functional here.
Oh, gosh, yes.
Kudos. Doctor, we always try to start Viewpoint with kudo about somebody or some organization. To try to, blow a little smoke for somebody because they've done something good or some organization. Today, I'm a little bit passionate about Lincoln College and its mission.
No.
You understand that.
Surely you jest.
I read today where we had 2 of our athletic teams, the Lincoln girls softball team and our baseball team, won high academic honors in the National Junior College Association.
Hallelujah.
So, that makes me feel real good to see these youngsters accomplish that. We've got, this is a result of, number one, of their attitude and their desire to do well, aided and abetted most significantly by some great instructors up there. So we've got
somebody must have been able to convey to them that there is life after softball.
This is life after
you might just
athletics.
as well prepare for it,
yeah.
Right?
Well, they apparently have done and this is a national recognition for teams around the country, and we are 2 teams. We're nationally recognized, so
that's wonderful.
It makes you feel real good.
Congratulations to them.
Do you have any report on being in the Razorback land at all?
It's warm down there, but I think that we can plan on experiencing that, especially tomorrow and Friday.
Yeah, you can get ready.
They said 104 this morning for tomorrow. But I guess, by the time you get up to 98, 99, 102, what's the difference?
Everything's relative from that point on.
Yeah.
Well,
Hot.
we have had some magnificent weather. Great for golf, I'll tell you that. It's been ideal.
Well, we dasn't complain because how would you like to be in Florida? Or how would you like to be in Duluth, Minnesota? I talked to my brother. Their home isn't all that far from Duluth, their town. And there was a friend of theirs who is having to have radiation treatments. And he has to get on a pontoon boat to go to a person who has a golf cart. He has to go every day now. And then the person with the golf cart takes him to John, who can get out on the road now.
Really?
Recently. And John takes him to the hospital to have his treatment.
That's pretty significant.
That's a lot for an everyday thing. And just think of the millions of people who are facing that kind of thing with all the rain they're having in their areas. We obviously don't have much of a rain problem here, other than lack of.
Way back in the quote, again, the good old days, before they dredged Salt Creek and so forth, Lincoln Lakes habitually flooded, and we lived out there at the time. And one year I remember we moved out because we saw the water coming up and went in to stay with my mother. And the next day, the water was clear up to where the old switch house was, where you start to go down Lincoln. Instead of going to West Kickapoo there, and you turn left and go down towards the lake, the water was clear up to there.
Yeah.
I waited in there to go get to my house to check, make sure everything was okay. And it was right to the bottom. I mean, it didn't get in the house. It got right up there.
Well, you were very lucky.
Yeah. Well, I have been most of my life.
We went on a mission trip from church once and along the river, and we're mucking out these houses that had been flooded. And was that a mess? And one of the ladies was, I think she was 94, and she, bless her heart, had gone to the basement and shot the snakes before we arrived so that we could just muck out and no snakes, which I thought was very humanitarian of her.
Say, PA, personal announcement here, public announcement.
Okay.
public relations for the Elkhart Historical Society.
Hysterical Society.
Yes. Okay. Once again, they're having a nice. They really have nice gatherings down there.
Definitely.
And the meals are really nice. So on the coming up real soon here, July 13th, Paul Beaver, a friend from down the street here, once again is going to make a little presentation. You know, those of us that know Paul know that he wrote a book or two.
Or two, yeah.
Yeah, and we've had him here, had visited with him. Anyway, Friday the 13th at 5:30 at the Wild Hare, Paul's going to talk about The Last Farm Boy. Then on the 27th of August, our good friend Dr. Dennis Campbell, again one of our Lincoln College professors, just a really enthusiastic young man.
Oh.
He's great. August the 17th, he's going to give a lecture. It's called The Elephants in Lincoln, which of course refers to the finding of the woolly mammoth tusk up there in Sugar Creek. And that again, that's going to be at 5:30, and that's going to be at the Wild Hare. $25, and that's not very much for this a nice evening. Now on the 9th, and this is, they have to get these reservations in. They're going to close on these on September the 9th, an enchanted evening at Crowhurst. That's at 5 to 8. That's music on the grounds of Crowhurst Mansion up there. Dr. S.W. MacArthur owned that house, built that house up there many, many, many years ago. And that's now the second residence of Bob Neal. And he has a rather interesting sobriquet for that. He called it Money Pit Number 2. So that's a nice evening. We did that last year, Gene and I, and it's a very nice evening. That's September the 9th. So get your talk to the folks at the Elkhart Historical Society, and I'll give you a number, 947-2238. 947-2238. Now, I think we have a nice guest this morning, and I think it'd be well if we bring her on the air.
Well, I think we best do that because she's got a lot to talk about, because she's into a very, very complex specialty. And when you need Dr. Lynn Dennis, it's not funny. You really need her. And she is a podiatrist at the little professional mall
park
on the corner of Union and Woodlawn. And
some call it.
I've been to see her, as have many, many, many other people. And I'm so glad you could take time to be with us this morning, Dr. Dennis, because what you do is very important.
It keeps us on our feet, so to speak.
Literally. She does keep us on our feet. And what age group would you say is your major clientele?
My major clientele is probably 70 to 100. I have mainly a senior population.
But children too, no doubt.
Yes, I treat everybody.
Yeah.
The children typically will come in for warts or ingrown toenails or infections. And then the 40 and 50-year-olds will come in for heel pain, plantar fasciitis. And then the senior population typically will come in for toenail difficulties, infections, or diabetic foot care.
Oh, that must be a big part of your practice, because that's so hard on people's parts, isn't it?
Yes. The diabetic population is exploding, obviously, and so is the need and care for diabetic feet.
Yeah. And really, if you're diabetic, wouldn't it be well for you to do some preventive things, like seeing you early on and starting a care program, so that you don't face what we know people have faced with diabetes?
Yes, most diabetic foot care is mostly preventative care. You know, a corn or a callus that goes untreated can become an ulcer and an infection and then an amputation. So if we can treat these things early, when they're just a corn or a callus, treat people how to care for them themselves, then we prevent those things from happening and prevent the bad things from happening that everybody with diabetes is afraid of. So,
and rightly so.
Yes, and rightly so.
I'd like to, Doctor, if I may, please, establish a little groundwork as to the amount of education it takes to be in your profession.
Correct.
So if you will, please take us through that, because there's this is not something you study up on a couple of weekend tests.
You
No.
don't go to the 6-week night course, do you?
I mean,
You do not.
With all respect, it's not a hands-on technical training.
No. You start with 4 years of undergraduate training, a basic pre-med degree, and then you go specifically to podiatry school. Now, when I went to podiatry school, they were individual schools, like 7 of them around the country. Now they have become more incorporated into the medical school settings themselves. When you're there, you do a 4-year podiatry degree. During that study, you do vascular disease, dermatology, medicine, surgery. So you study all different aspects of medicine. So you just don't study the feet. You learn about diabetes, you learn a complete anatomy of the body, because even though the feet are down there, they're connected to the rest of the body.
And have a direct effect on how the rest of the body feels, by the by.
Correct. And then once you're done with that, you do a 1 to 3 year residency. I did a 1-year residency at a veterans hospital in the inner city of Chicago, which was an experience.
Yes, I expect.
And then I did a 1-year fellowship with a doctor in inner city of Chicago also. And then once you're done with that, you have to do continuing education credits, and that's about 100 hours every 2 years that I have to continue to go to.
Oh, my.
So you go to different lectures and things, classes all around the country, continue your education.
Now, where would be a school in central Illinois that you could go for podiatry training after you finished your undergrad?
Chicago is the closest, and now it's North Chicago. There's one in Iowa, there's one in California, and I don't remember where the other ones are, Florida, I believe. So they're usually major metropolitan areas. So, but there's only 7 or 8 of them in the country.
Whatever made you decide after you'd been through all this schooling that you'd want to be a podiatrist? Because that isn't what you set out to be, is it?
No. I set out to be a biomechanical engineer. My father had worked with engineers. He worked in the power company in Michigan. So he was pushing towards engineering because he knew that is a stable career. But I like the people part. I enjoy sitting down, talking to people, helping people. So I was going to do biomechanical engineering, develop artificial knees and hearts. When I was growing up, that's what was really big, was the artificial heart had just kind of come into existence. So I was looking into that. But then...
George wants in.
Okay.
Oh, no. Go ahead, I'm sorry.
But then I didn't like the engineering part as well. I like the people part. So then
We do well at that.
Yes, I love people and love helping people.
Yeah.
So
Yeah. We have a
call.
We have a call,
Dr.
so-
Dennis, if you'd use that
Okay.
earphone there, you could hear what the
and this
person
being
has to say.
the station that we are, Judith and I will share headsets. This is a first-class operation, Doctor. Go right ahead, caller.
Hi, I have a question.
Okay.
I'm 40 years old and do not have diabetes, so I guess you could say good health. But I was told that if you go for a regular pedicure, then that's good maintenance on your feet. Is that correct?
there is a lot of discussion on if pedicures are good in this world. You have to really make sure that you're choosing a pedicurist that really does sterilize their instruments well. There's been a lot of infections and problems that people have had because of improper sterilization and also the soakings that they do because they're unable to clean the material as well as they should. I'm okay with pedicures. Being a woman, I like pretty feet.
Yeah.
So I'm okay with that as long as you have a trusted pedicurist that you have a good relationship with. And there are some excellent pedicurists in town. You know, there are a couple that I have patients come from regularly, and they do wonderful jobs. So I don't have a problem with the pedicurist.
That's good to know. Is there any other questions, caller?
No, I appreciate it. Thank you.
Thank you very much for calling. We appreciate that.
Let's say 648-5510, which we say so seldom. If you have any questions for Dr. Dennis, because many people have many questions about their feet. Now, you were talking about originally thinking about going into the development of artificial parts, and we're like cars anymore, you know, put a new fender, a new bumper on us and send us on our way. And I have lots of friends who have new knees. But if you don't take care of your feet, couldn't that affect the rest of you, like for instance your knees?
Yes, a lot of times I'll have people come in and they'll be very flat-footed. Their feet will turn in. And as I'm talking to them, they'll say, yes, my knees hurt, my lower back hurts. And often I'll put them into a good New Balance shoe.
Well, I'm a believer, believe me.
And often a good orthotic, which will straighten their feet up, and their knee pain will go away.
Sometimes you'll be walking behind someone and you'll notice that their shoes are walked over, we used to call it.
Correct.
So that the heel on their shoe is much shorter on one side than the other. Is that something that you face regularly? How does that happen to a person, and what does one do?
That is the pronation, the flat-footedness that I was talking about. You have to really make sure that your shoe counters, you keep your shoes up to date. Once those shoes start to go over, then the foot goes over and you're prone to more arthritis in the foot.
I mean, I have to go buy shoes at my age.
You do. And your knees and your hips
trying to get
might
through
make
the
your
line.
lower back feel better.
Yeah, there you go.
I'm trying to get out of here without buying any more clothes, you know.
Are you kind of critical of some of the footwear that I dare say it's more women than men, Mr. Bill,
Yeah, well, that to be true.
choose?
Yes. Because
Yeah.
obviously the flip-flops are really a problem.
I always wonder, I can't stand those things because I don't like anything that fits that way, like the thong sandals
Yes.
that people wear. That's not comfortable for me personally, but my kids used to wear those all the time when they were little.
There are so many problems because of the shoes. A lot of the hammer toes and the bunions and the heel pain are just from improper fitting shoes. So if people chose to wear better shoes, they would have less problems.
What about when we girls used to wear those ever so pointed high heels? It's the cat.
This is the new arrival, and she's here for a pedicure.
I'll be busy for a long time. She sure is pretty.
She is pretty, but she's fickle. She wants to
Fixture.
be in here, and now she wants to
She's
be out in
fixture.
about 2 seconds. How about those old pointed toe heels that we all wore? I certainly was a transgressor in that area.
Luckily, most people realize now the importance of their feet and are willing to make some modifications. Some of my senior patients, the little ladies who have worn the pointed shoes for all the years, they have a hard time not wearing those shoes. And our foot adapts to them. Our foot becomes more pointed. Obviously, if you wear a pointed shoe, our heel cord gets tighter. So sometimes changing those people out of shoes that they've worn those high-heeled shoes, they can't tolerate it. Their heel cord has become too tight over time.
You know, my youngest daughter ruptured her Achilles tendon when she was in college,
That's not funny.
and it's still a problem to her.
Yes.
Is that certainly would be one of the things that you might face in your practice?
Yes. Achilles tendon ruptures aren't probably that common compared to other problems that we see, but it is a chronic problem. That tendon is very important.
Well, she'll vouch for that.
I have some questions that sent in by an iPhone.
Oh, okay.
That little rascal right here.
Love
And
technology.
the question says, yes,
I envy you.
I have been having some real bad foot pain, and it is getting worse. I work in fast food, and I'm on my feet for up to 8 hours a day. That's not easy, by the by.
No.
I've been wearing Stretchers shape up.
Sketcher.
Skechers. Ah, thank you. That's myopic eyes. Skechers shape-ups for work and thought they were the cause. I have purchased new shoes and my feet still hurt even worse. Please help me. Sincerely, Achy Breaky Feet. And Ann Landers.
I like
Ann
that.
Landers column.
I like that.
All right, there's your question, doctor. I've been wearing Skechers shape-ups for work and thought they were the cause. I purchased new shoes and my feet still hurt. Young lady's on her feet, I presume young lady. Could be an old geezer, but not necessarily in a fast food restaurant. Working 8 hours a day, tough job too.
It is a tough job. Standing, our feet were not meant to stand at 8 hours, especially in one position. So it is better to try to move around as much as possible. The verdict isn't really in on those Skechers, and Skechers are those shoes that basically roll and propel you forward.
Never even heard of it until just now.
Yeah.
Oh,
I've seen some injuries from them, a lot of ankle sprains and problems like that because they're a rocker bottom sole. I still like the high number New Balance tennis shoe. I don't think you can go wrong with a good running shoe. Like a New Balance or a Beast, a Brooks Beast is a good shoe. A lot of times just a very good arch support can help if you're standing on your feet for a long period of time. And we make those. They're basically made from a mold from your foot, and you put it in your shoe to help hold up your foot. And that stops a lot of the pain because gravity's pushing down. So you need something to help hold back up that arch.
Sure. Well, and as the years go by, gravity seems to chase you even closer
Gravity does.
in a myriad unhappy ways.
I know that. This is going to come as a real shock to you,
But
but I do try to prepare for some of these programs, you know. So I really do.
I know
Thanks to the internet, I was amazed to find how many bones there are in the foot.
It's amazing, isn't it? A third of your body's bones.
I
are in
looked
your
at the
feet.
anatomy of a foot, a breakaway
a
on
third
that.
of the body's bones are in your foot.
Say that a third of our bones are in our feet.
Yep.
Holy Friday.
That's so there's so many things that can go wrong with them. Between fractures, sprains, dislocations, infections.
In fact, I counted 32 specific foot ailments that, according to this Wikipedia.
Yeah?
So you do like technology.
32 going from sprains to warts,
Okay.
starting from aardvark to zebra. Welcome back, Kat. So, what are the most common problems that your clients or your patients will come in to with?
Probably the number one is onychomycosis, which is toenail fungus,
Oh.
and the difficulties of cutting the nails. As we get older, the nails get thicker and they become more difficult to cut.
It's also harder to see, I can tell
Harder
you
to
that.
see, and harder to get down to. So,
I noted that.
yes. So, onychomycosis and corns and calluses are probably my number one problem that I see. Then the diabetic foot care. And then probably the plantar fasciitis, which is the horrible heel pain, those first few steps in the morning that make you feel very, very old and uncomfortable.
Does the surface that you spend your day on make a difference? For instance, if you work on hardwood floors or carpet as opposed to a concrete floor?
Yes. I do see an increased incidence of people that are on hard surfaces having problems. You know, the factory workers, the fast food people, grocery stores. It's just hard. There's no shock absorption in there. It's just basically...
That's right. So you have to kind of counteract that, I suppose, by the shoes you choose, right?
The shoes and the inserts. Often I'll choose a different type of insert if I know what kind of work the patient does.
You know, sometimes when you look at an older person's foot, their
Not a pretty
poor
sight.
toes, yeah, really, in spades. Their poor toes are going 7 ways from Sunday, you
Yes.
know? And it must hurt, because they aren't meant to be that way.
That's a lot of times it's just severe arthritis.
Uh-huh.
We're going to, I want to give a commercial for a doctor in a minute, but we're going to, in the meantime, we're going to take, this is a, for-profit radio station, and we have to do these things called commercials so that we can pay for these programs. So I'm going to turn that over to the station engineer now, and Mr. Ash, go right ahead, sir.